Hello, welcome to the OPSIS website and reinventingoptometry.com. In this short video, I'll be demonstrating or talking about some of the different targets that we use for the activity called column jumping. The column jumping activity uses a standard Hart chart. There was a Dr. Hart, H-A-R-T, and this is one of his original types of charts. Now, columns are obviously vertical stacked things, and here we are showing that how we're going to label the columns. Column 1 is here, 2, 3, and going to 10. So at one of the first levels with this, and the boxes, the vertical rectangles here, and the numbers at the top would not appear. Just to be very clear here, the activity is done with a Hart chart, and on the website reinventingoptometry.com we'll also have on the column jumping page reference to the computer program Vision Builder that will allow you to make different charts in different configurations, different spacing of letters and numbers, upper and lower case, different sizes, etc. But we're going to use the standard Hart chart here. But the chart that we use for the activity will not have either the numbers up top, nor will it have the vertical boxes around the columns. This is just to give you a sense of what we're after. So we start generally with two columns relatively close together. The task here is to call off the letters in those columns as quickly as possible from left to right, top down. So in this instance, and we highly advocate using a stopwatch to help drive achievement in this, what we're looking for, and this would be typically put on a wall, a vertical surface, and the person would stand 2.5, 3 feet, 1 meter away. And we asked them to call off the letters. And what we were looking for is something like F, P, B, K, T, W, X, R, A, V, P, O, R, D, X, S, M, A, O, N. And we would hit the stop on the stopwatch. But we asked them to go as quickly as possible. At the end of them finishing, we typically ask, how did you do? And want their assessment. Did they start and stop in the correct columns? Did they miscall any letters or any of the targets that you're using? And we go from there. In this short video, we're just going to show you the progression of the types of targets that we use. So we typically begin with two columns starting rather close together, moving to two columns spread apart or out towards the edges. Here we would be using columns 2 and column 9, and the person would have to go F, H, B, R, and I think you get the idea all the way down to the end. Now, when the columns are close to the edge like this, they're relatively easy to get to be accurate in finding where to look and what to call off. And in fact, one like this, that's 3 and 7, often becomes, the challenge becomes staying in the correct place. And we'll see them typically slow down in something like this. The thought pattern is that obviously this, two of them very close together, would be rather fast, and it typically is. This often, people think it would be slower, but it can be rather fast, again, because 2 is very close to the edge, 9 is close to 10, which is at the edge. So it becomes easier to keep your reference point. Whereas 3 and 7, like this, that are closer than 2 and 9 are to each other, requires a little more patience, reference, maybe a wider view. At any rate, the person has to keep themselves more oriented into the total volume of space, and often we see this one, they go a little slower. Once we graduate from this, where do we proceed? We typically proceed to 3 columns, and this is demonstrating 3 columns regularly spaced. So the space from 3 to 5 and 5 to 7 are the same. The return sweep from 7 back to 3 is a larger saccade in the right to left direction. But again, here they're making a small jump, return, small, return, small, return, beginning to learn some of the eye movement patterns we typically associate with reading. Once we go from the 3-column regularly spaced, we move to 3-column irregularly spaced. So here we have a small jump, large jump, return, small, large, return, small, large, return. And they work their way through this. We would do various combinations of this. It helps with many things, and that will be discussed both in written materials and in your course. Please look at reinventingoptometry.com, and our mission is to advance human progress through research and education on vision, the visual process, and clinical care. Thank you.